Okay, so I know above I was talking a lot about the knee itself because that is a lot of what we deal with NPS. However, in PT school and in general, we are taught to look at the whole body. You know, we want to look above and below every joint. So usually, in a normal person, um, you know, if they're having knee pain, we are taught to look above and below, like look at the joints above and below. It Most of the time, it's not necessarily the knee itself. So what that means is, you know, look at the hip, look at the ankle, look at the core. You know, look at those other things that could be causing issues. So something my professor talked about was, is it the train on the tracks or is it the track under the train? So is it the train being the kneecap itself? Because again, this is a big issue, not necessarily just in the nail patella syndrome community, but with athletes, with like anybody. Yeah, so there's usually some sort of imbalance, and sure, it definitely could be the muscles around the knee, and you know that's something we really need to consider with people with nail patella syndrome. But a lot of times, you know, there's a lot of issues with the hip. The hip could be weak, so what happens is if your hip is rotating improperly, it then puts your kneecap and your knee in a position that it's not supposed to be in. So your knee is mainly a hinge joint, meaning it's just bends and straightens. But if your hip is too weak, or your ankle is too weak or something, and it kind of puts your knee in a position that it's not supposed to be in, the knee might end up starting to like rotate a little bit. So it's not really supposed to rotate much. But if it's trying to compensate and trying to make up for the weak hip or the weak ankle, you know, it's doing its best. Our bodies are really smart. They try to adjust the best that they can to keep us functioning. But that could, in the long run, end up causing knee pain, or a knee dislocation or subluxation or, you know, ligament tear or anything really. You know, it's preached on us right now in research and in school that the glutes are super important, and they are. And a lot of times, so they will help control the internal and external rotation. So if your glutes aren't strong enough to control your leg, sorry, hard to explain. So your leg might internally rotate. So I'll explain and show this a little bit better. Putting your knee kind of at an awkward position, and then your kneecap's just kind of there like floating. You know what I mean? It's not really like, what is it supposed to do? It's just trying to do its best to keep you functioning. And so what happens is if your thigh kind of internally rotates, then your kneecap might kind of go out to the side because it's still kind of in that straight track. I'll show that a little bit better in a second. Same thing with your ankle. So if your ankle is overpronating or just doing something funky, then that tends to be the case. But yeah, then it's going to throw your knee into a position that it's not normally in, it's not supposed to be in. But again, your body still wants to function, it still wants to work. So it's going to do its best to keep you moving. And that might just end up with some knee pain because our bodies are very smart, but you know, they don't really know when you're overusing it. And in this day and age, we're also go, 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 and we tend to overlook those little things. You know, we might have like oh, it kind of hurts a little bit, but then all of a sudden you're doing it all the time consistently, and now it's like this crazy pain in your knee. So I'll show this here in just a sec. So it's going to be kind of strange because it's just going to be my legs in the picture. But so hold on. Okay, so first off, hold on, I'll put this here. It's taken a while for me to build up muscle in my legs, like years, just because I am small and I have nail patella syndrome, whatever. But I do work out a lot, and this is kind of my job, so it's important for me to, you know, show fitness and be a good role model, I guess. So what I'm talking about with the hip here. So my glutes are kind of keeping my hip in line here, okay? So if they're not really strong, you know, you're kind of going to you're not really going to be able to control this leg. It's going to kind of come in, it's going to buckle. A lot of times people see that with like squatting, so people's knees will kind of come in. If you strengthen your glutes, you know, it'll keep them out kind of thing. So if they're strong enough, your legs should be out, they should be fine. But if they're coming in, you know, you can kind of already see my kneecaps are kind of going up. They're staying out to the side. So they're kind of, even when I do that, it kind of hurts my knee, to be honest. And side note, I have dislocated this one twice and dislocated this one once, and a surgery on each, and, chipped some cartilage and bone off this one, but hey, it's life. I did used to wear 2 knee braces, and I have done a lot of exercises. That was like 10 years ago, so yeah, to kind of get back to where I am now. But yeah, so you can kind of see, I don't know. Let's see, so you kind of see that. So again, that's kind of more the glute area. So if this is weak and that's happening, it might not be these muscles necessarily. It could be your butt, your glute muscles. Now, same thing with the ankle. So if my ankle, if I'm just walking along or, whatever, if I land or if I'm balancing or something, and my ankle is kind of rolling in like this, see how, once again, my knee kind of comes in? So it's kind of putting my knee at this awkward angle where, of course, I'm going to have pain. That doesn't even look comfortable. But, yeah, so we kind of, as PTs, have to diagnose that. This is usually a lot of what we look at now, so strengthening everything, because it could be the ankle, it could be the knee, it could be the hip, it could be all of them. It could be 1, 2, I don't know. But, so we have to look at all that as a PT. So, especially with Nail-Patella syndrome, we really need to consider, is it the knee, or is it above or below, or is it all the above? Because, again, we have a different anatomy. The kneecaps are smaller, and that's different than the normal population. So, or maybe you don't have kneecaps, so that's definitely different than the normal population. So the exercises I'm going to kind of provide you with below are for not just the knee, not just the quad, not just the hamstrings. They're for your hips as well and your ankle, and just to work on that overall balance. Sometimes, too, it is, maybe your muscles are strong, but your body isn't recognizing what muscle to fire first. So if if like the side of your leg is kind of firing first and it's trying to pull that kneecap out, or if you're rotating improperly and like your muscles are just firing improperly, that's a lot more to do with the core muscles, I'd say. But yeah, so working on like balance, working on just your mind, kind of understanding where your body needs to be in space. That's kind of, hopefully that's easy to understand. But yeah, so it's not just the knee. We want to focus on the whole body, the whole person, and just making sure you're doing the proper things. Yes, and strengthening everything.